I'm Dr. I.P.S. Kochar, pediatric and adolescent endocrinologist and diabetologist. Today I will be talking to you a little bit of thyroid. This is a lot of concern among the children and parents about thyroid because there are a lot of pediatric patients and a lot of newborns and a lot of children who are getting thyroid these days. Not only that, the parents also have thyroid. So they are concerned whether the child will get thyroid or not. So this is, as you can see, this is a thyroid gland, is the gland which is present in front of the bones, the hyoid bone here, and this is there's a right lobe and there's a left lobe connected to isthmus. The function of this gland is to produce thyroxine, which is required for the normal metabolism of the body. So day-to-day metabolism is dependent on thyroxine. Now when we are talking about thyroid gland, it causes the deficiency of thyroid gland production of thyroxine will result in hypothyroidism, and if there is excess, it will cause hyperthyroidism. So when there is a deficiency of hypothyroidism, there are some symptoms which you can find in the children. And let us start first with a baby, a newborn. What do you find? Normally in newborns, they will not present with anything. That is why in most of the countries, in our country also, there is universal screening of thyroid function done, which is called as TSH, thyroid stimulating hormone. If the TSH is high during a birth, then we have to follow up these babies for hypothyroidism. Now, when normally they might have a prolonged jaundice. The baby may be lethargic, sleeping all the time, not taking a feed properly. This will be there. Or in later childhood, the child may be gaining weight. The child may be having little school performance may be affected. The child may be lethargic. Child will not be having stunted growth. So these are things you may find in children when this thyroid is involved. Now, this is there, and along with that, main thing is that the child growth will be affected. So if there is very high level of TSH, hypothyroidism is very much affected, then the child will not grow properly. The child will be little chubby, will be having a short height. So these things will be there. And in girls who are adolescent girls, bigger girls, you may get menstrual problems. You may get periods may be irregular. There may be less periods. They may be gaining weight. They may have later on in life infertility problems. So these are things. Then there is a dryness of the skin, loss of hair. These are symptoms, if they are present in the children, must be seen by a pediatric endocrinologist. Now there is a condition where you can have excessive production of TSH. Their TSH is going less and thyroxine is more produced in the body. So therefore that is called hyperthyroidism. The functioning of the thyroid is becoming more. So the gland is functioning more, it is becoming bigger and vascularity is increasing. Now there in this condition you will have a child with perspiration, commonly seen in girls at adolescent age, commonly seen in boys also, but more common in girls. And during this time, they produce excessive amount of thyroxine, which causes tachycardia, perspiration increasing, anxiety, school performance becomes less, weight loss is there, eating lot of food but still losing weight. These are the common symptoms if you're in hyperthyroidism. The treatment of all these conditions is depending medication are required, but the very important thing to remember that if a child or adolescent gets hyperthyroidism, he needs to take medicine lifelong. So there's a myth whether this medicine which you are taking, thyroxine, causes problem. No, it does not cause any problem. It has no side effect. It is a normal hormone of the body and it's a deficiency. So deficiency is replacing this hormone with thyroxine from outside. So that's very important to remember that this is not a disease, a deficiency. Secondly, that it has to be given lifelong, the medicine. And third is that there is no side effect of the medicine which you are taking unless you overdose the medicine. So this is there, and so that if your child is having weight gain, if the child is feeling lethargic, if the child is feeling tired, if the child is losing hair, if the child is having some school performance problem, child is not growing properly, there is stunted growth, the child is little lethargic, he is responding slow. So you must think of hypothyroidism and must go and see a pediatric endocrinologist. So this is as far as thyroid is concerned and the problem with thyroid. And I will like to just inform that you can contact me or contact Lybrate.com for this problem if a child is having any of these symptoms, and you can come to my clinic. So this is as far as hypothyroidism is concerned.